I'm Dr. Yu. I'm a facial plastic surgeon here in beautiful Beverly Hills. And today I'd like to talk to you about revision rhinoplasty through one of my wonderful patients who came to visit me from Indonesia. So I do have a lot of revision rhinoplasty patients and a lot of international patients, some who have come from Indonesia to see me to correct previous work that has left their nose either aesthetically or functionally deficient.
Halo, saya Shindy. Saya sebagai entrepreneur di Indonesia, saya mempunyai brand Shine Cosmetic. Saya memilih Dr. Yu untuk menjalani operasi hidung.
Hi, my name is Shindy. I'm an Indonesian entrepreneur, and then I have my own skincare and cosmetic brand. The name is Shine, and then she's here in the clinic to do the nose surgery, rhinoplasty.
In Shindy's case, functionally, she had no issues at all, and she actually liked her nose overall, but wanted to improve and enhance upon what she had.
Jadi pertamanya itu ya jelas aku cari referensi ya. Referensi dari teman ke teman. Terus karena kan banyak banget sekitar teman aku yang emang dia tuh operasi hidung juga. Dari mulai di Bangkok lah, Korea lah, aku tanya Karen, aku tanya salah satu teman aku juga kata Tasya, Revina, dan lain-lain.
Tapi kenapa emang hidung bunda mau dioperasi?
Ya pengen aja.
Okay, she's basically saying that she doesn't have any problem.
Ini pilihan terbaik gue.
Okay, she doesn't.
Gue tuh pengen punya hidung yang emang point. Gitu.
She doesn't have any problem with her nose, like with her existing nose. She just wanted to have like high nose, tall nose, pointy nose, even better than what she has before. So she's doing some research. She's asking some of her friends, and then she's checking like some of the doctors in Bangkok, in South Korea, and also in the US. After all of the research, finally like she decided to go to Dr. Yu.
Karena Dr. Yu itu dia tuh kayak punya seni yang emang bikin hidung tuh kayak
yeah. She said that Yu knows. So when Dr. Yu do something on the nose of the patient, she said like there is something about Dr. Yu nose that has the signature shape. I don't know what she meant by that signature shape. Maybe Dr. Yu can explain.
The defining characteristics of a U nose include a bridge that is projected and refined with a nice dorsal aesthetic line that has a curvature towards the middle vault or the middle part of the nose, so that there's a beautiful hourglass shape that balances the shape of the tip, that also has greater projection and a little slope relative to the bridge. Looking at Shindy's nose, you can see that the profile is straight and even has a slight supratip fullness or polybeak deformity, whereas afterwards you can see a nice feminine, beautiful slope that is characteristic of a U nose.
She likes the shape of Dr. Yu nose.
Dan satu lagi.
One more.
Karena di yang lain itu jarang sekali menggunakan tulang kepala. Ini adalah tulang iga, tulang kepala dan tulang telinga. Biasanya kan cuman kayak silikon atau tulang telinga dan tulang iga.
Okay.
Tapi ini tulang kepala yang menurut gue kayak ya udah ini tangan deh buat gue.
Okay. And one more thing that make her convinced about Dr. Yu, because Dr. Yu during the Skype the consultation with her, Dr. Yu mentioned that Dr. Yu will use the fascia of the head, and then also something from the ears, and then also from the ribs. The other doctors only mention about the ribs and the ears, but never mention about the fascia head. That alone already make her feel like I think this is like so convincing.
Karena ini gue udah janji operasi hidung terakhir gue.
And she mentioned that this is actually she wants this to be like her final last nose surgery.
Even though this was a very complex revision surgery, since she had had previous surgery from a very well-known surgeon in Turkey, I was able to offer her a plan to revise the nose, even though it was a very complex revision, using grafts that I would customize and tailor specifically to create even more enhanced definition and refinement to her nose.
Ini bahagia banget loh.
She's super happy.
Walaupun aku masih bengkak ya di daerah sini kan, katanya kan nanti kalau udah bengkak ini aku bakal lancip kan, berarti bakal tambah lagi tall lagi kan, lebih mancung lagi.
She said like she's totally happy, no regret at all, even though like at the moment like her nose is still swollen, And after the swollen goes away, the nose will be like more sharp. So this result is already make her happy, and then she can't wait to see the nose is like getting smaller and sharper.
Shindy was able to achieve greater definition and projection of her nose from her previous rhinoplasty, but it left her with some contour irregularities and aesthetic deficiencies that left her nose looking not as good as she wanted. And so amongst those included a tip that was sharp and pointy at the tip, but still had a lot of volume laterally or to the side, fullness in the super tip or area above the tip, creating a polybeaked appearance, and a bridge that was deviated and also not sufficiently defined in between her eyes.
Proses penyembuhannya sebenarnya di hari pertama aja yang kayak mau dicabut nyawa ya menurut aku. Karena emang ini sakit banget ya di bagian apa sebenarnya tadinya tuh mikir bakal paling sakit di daerah kepala. Ternyata itu nggak sama sekali. Bener-bener kayak iga kayak tapi itu cuma di hari pertama aja sih. Tapi hari kedua, hari ketiga kayak bahkan kita kemarin ke Disneyland main roller coaster. Kayak apa emang gue terlalu kuat? I don't know.
So she mentioned that the healing process is like just fine, and then she just mentioned that the pain is like super painful on the first day, especially in the ribs. And then before the surgery happened, like she's worried about the head because it's like this is the first time she's going to have something on the head, and then she's like, oh, maybe the head is going to be like super painful, but it's not. Like the head is like totally okay. She didn't feel anything, but the ribs, she says, like very painful. And then she's like she's just mentioned that the ribs is very painful on the first day, but after that it's very okay. She even mentioned like a week after the surgery, like she went to Disneyland, taking the roller coaster ride. I don't know, is it allowed or not? The Goofy ride, the Guardian of the Galaxy ride, whatever. So she's feeling okay, and then she's happy because like every day she's taking picture and then send it to Dr. Yu personal assistant Haley, and then Haley says like everything looks good and everything looks normal. And she's feeling okay. Basically, like the healing process is like fast.
Dan ini cara gue untuk bersinar udah tepat banget.
And this is, she mentioned that this is her perfect way to shine.
To shine.
Shine
everywhere.
Shining everywhere.
Shindy did mention to me that post-op day one, she was in a lot of discomfort, and especially the rib, which is normal for it to be sore, was bothering her. However, compared to her previous surgery with a surgeon who left a scar that was 3 times as wide, she said it was a walk in the park. And in fact, she did walk in the park, Disneyland, in a week after surgery.
Dari sebelum operasi pas aku ada di Indonesia, itu timnya tuh kayak sampai asisten aku tuh ngomong gini. Asisten aku bilang kayak, gue harus ketemu itu Vivian itu kayak gimana mesin. Karena Vivian itu kayak bener-bener tiap hari literally ngingetin aku jam melakukan satu hal yang emang dilarang sebelum operasi kan. Ya betul kan, itu Vivian kayak Olive kayak iya kan, kalau nanya Vivian itu kayak gimana bentukannya gitu kan. Nah terus dari yang awal konsultasi sempat agak ngedrop karena emang ternyata dokter Yu itu benar-benar dia tuh profesional banget. Jadi ada tes yang emang ternyata aku masih melakukan hal yang dilarang dokter Yu. Akhirnya dia tidak mau melakukan operasi tanggal 22 November dan aku di situ maksa kecewa.
Betul.
Dan aku bilang kayak dokter Yu mana, gue tanda tangan aja kontrak, nggak apa-apa terjadi resiko sama gue yang tanggung jawab. Tapi dokter Yu nggak mau karena itu melanggar kode etik sebagai dokter. Nah dan setelah itu akhirnya ya udah tanggal 5 Desember kita operasi, operasi. Dan ternyata di operasi itu dari mulai sebelum operasi yang kayak ada Gary ya namanya. Gary itu kayak halo jam 5 pagi subuh dengan kayak oh lu ngasih gue spirit banget ya pagi-pagi dong. Karena kita jam 5 subuh kan. Terus ketemu lagi dokter anestesi dan disitu aku sadar. Abis itu ya udah kita pas dibangunin Gary kan. Yang pertama kali gue tanyain adalah kontak mata lens gue karena gue -8 gitu kan. Tapi Gary tuh bener-bener kayak ngejaga gue banget. Sampai gue hafal itu nama perawat-perawatnya, nggak tahu dokternya kayak Heli juga baik banget. selalu kayak intensif banget nanyain keadaan hidung aku, terus suruh motoin gitu
Yeah.
kan. Dan ya menurut aku timnya sangat profesional sampai aku tahu namanya satu-satu.
Yeah.
Ada juga Heli, thank you Heli, bikin aku juga semangat.
Haley
ya kan?
Yu ya.
Heli you, ya kan gitu. Pokoknya aku kayak sampai nama-namanya apa.
Yeah. So she mentioned like she's very happy and totally like thumbs up for Dr. Yu team because like she mentioned before the surgery, like when we still in Indonesia, we did the Skype consultation with Dr. Yu and Vivian. Vivian assisting us from the very beginning, and she was like wondering when we were still in Indonesia, like how does like Vivian, what is she looks like? Because Vivian is very,
Olive.
yeah. Olive is like Olive is her assistant. Olive is wondering like what she looks like because Vivian is very meticulously detailed. Like Vivian is always like mentioning about things that she can do and she can't. And then Olive is like, oh, Vivian is very detailed. And then she's like amazed with the, like with how Vivian helped us. And then always reminding us about this and that, checking on us, like where we're going to stay. And then just basically make everything's like perfect. And then when we hear, there's a little bit story about her being super disappointed. Like she was crying. She was like, furious even because she didn't pass the test. There is one test that that she has to go through before the surgery operation, and then she didn't pass the test, and she was like, no, I still want to do the surgery like the schedule, which is November 22nd. But Dr. Yu insisted on postponing the surgery because she wasn't ready at that time. Because she wasn't ready, and then everything has to be, like in order, like everything has to be like, perfect to make her nose like beautiful, perfect, high nose and tall nose. And she was like, Dr. Yu, please, I will sign whatever that I need, I have to sign to make the schedule still running on November 22nd. I will take whatever the race is. And Dr. Yu, with plain face, just say, no.
Karena itu juga gue lagi kecewa karena anting 9 kerut gue hilang.
And she was like, it was like
9
bad.
kerut kan 18 kerut yang sebelahnya yang hilang.
Yeah, so it was like a very bad day for her because a day before she just lost her 9 carats diamonds on the flight to the US, and it cost billions. And she was like,
gue kok bertubi-tubi ya.
she was like, oh my God, I just lost my diamonds earrings and now my surgery has to be postponed. No, she was like crying. And then she almost lost her Hermes bag like a day before the consultation, before the test on Hollywood Hills. So she was like, oh my God, this is too much for me to handle. And she said like, no, I want to sign everything. Like, I want to take all the risks. I just want to do the surgery now. And Dr. Yu said no. So she was disappointed at the time, but it took like 2 days after she was like, oh, Dr. Yu is really professional. So
Saat gue udah gak emosi.
yeah, after the disappointed like fade away.
Akhirnya sebelum melakukan operasi gue nyogok Dr. Yu pakai sprinkle.
And before the surgery, she was like, Mika, I need to apologize to Dr. Yu. How is the best way? I can't speak English that well. Oh, I want to buy something sweet for Dr. Yu. So she stopped at sprinkles. and then she bought sprinkles for Dr. Yu. And then she also mentioned about the day on the operation. Like Gary, it was Nurse Gary. It was like 5 a.m. in the morning, and we were all like, super sleepy because the procedure started at 6. And Gary just like opened the door 5 a.m. with like super high energy. Like he's so energetic. Like she mentioned that Jerry actually like lifting our mood up because Jerry's like, hi, how are you? Oh my God, wonderful. And it was like, oh, we love Jerry. We love Gary. And then the Dr. Simon, the anesthesia doctor, also like he's nice. And then Of course, Haley, the personal assistant of Dr. Yu, also keep checking on her on daily basis, like asking the picture, and then she even like answer our question like in the middle of the night when we are asking about something. And also Haley Yu, for being so pretty and beautiful, because we keep checking on her Insta story.
My assistant, not me. My assistant. My assistant.
Olivia, her assistant, keep checking on Haley Yu Insta story. I'm like, oh my god, she's so amazing, she's so beautiful. And it was like, oh yeah, and then she's like pretty and very friendly and
Good girl.
very very kind, very like friendly, like supporting. Yeah, that's a story about the team. Are we talking too much?
One of the challenging aspects of Shindy's surgery is the fact that she had previously had areas that I commonly use for cartilage grafting depleted. A lot of surgeons perform rib rhinoplasty and even DCF rhinoplasty, and she had previously a DCF rib rhinoplasty. But the grafts were shaped in a way that was a little bit rudimentary and coarse and left her nose without the ideal contours. So one of the issues was the fact that her DCF or dice cartilage fascia graft was not precisely sized and shaped for the bridge of her nose. And so it left her with a bridge that was still low, asymmetric and deviated, and also significantly lower in the starting point than it would be ideally. So the area in between her eyes lacked definition, and her nose, even though taller than her original nose, was still short. The second issue was that for her tip, the ALIS still had a lot of flare and width because the tip lacked projection. Her tip also came to an unnatural point because the tip grafts were shaped in a way that led to a single edge instead of creating the tip aesthetic that we all love.
Kalau misalnya ada orang yang mau operasi hidung, apa saran Bunda buat orang itu sebelum operasi?
Yang pertama ya pastinya harus punya duit ya, Wak.
Ya betul, ya itu betul. Itu penting.
Terus yang pastinya jangan sampai salah milih dokter. Karena referensi temen doang tuh belum tentu benar.
Betul.
Ada lah terjadi di teman-teman aku yang emang seperti itu, ternyata hasilnya kurang baik dan bahkan merusak hidung. Jadi harus benar-benar kayak kita udah punya duit nih, baik kita harus cari dokter yang tepat. Karena jangan sampai operasi hidung itu jadi kecanduan untuk mencari terus hidung yang terbaik. Sebenarnya balik lagi, operasi yang kamu mau bentuknya gimana, karena setiap dokter itu beda-beda hasilnya. Kalau aku tipikal yang emang sukanya yang Hollywood nose gitu, dan memang aku sukanya tipikal yang memang dokter Yu punya seni gitu, karena dokter Yu buat aku tuh kayak dia mempunyai seni itu sih.
Okay, so she mentioned like if someone of you guys like want to do rhinoplasty, like first thing first, make sure that you have money.
It's true.
It's true. You make sure that first you have money, and then the second, like do your research, do your homework, because different doctor got different results. So there is no such thing as
Karena
good doctor or bad doctor.
Gue tuh ditawarin kan buat sama dokter yang Korea untuk melakukan endorsement rhinoplasty, tapi gue gak mau.
So before she got into Dr. Yu, like she actually got some offer from the rhinoplasty doctor in South Korea, and it's like totally like endorsement. Like the doctor will do her nose job like for free. That she just need to
Gue lebih bayar untuk
make
kecantikan.
she just need to make the video and post like the procedure, but she said no because she wants the best for her, not the one who gave her free treatment, if that makes sense, because she wants like the best. Because when you do rhinoplasty, you have to make sure that first you find the right doctor with the right nose, the shape of nose that you want, because different doctor will give you different result of the nose. And Shindy mentioned that Dr. Yu nose is actually the shape that she's been looking for, and she really likes Hollywood type of nose. And she decided that Dr. Yu is probably like the best for her. That's the journey before she finally decided to do the rhinoplasty in Dr. Yu.
Treating international patients is always a challenge, because my staff and myself need to ensure the most rapid, smooth recovery possible so that those patients can leave on a timely manner back to their home. And so for Shindy and for all international patients, I do recommend a stay of at least 2 weeks in the LA area to ensure that if any complications do arise, which they're always a possibility, although it is minimal, that they can be addressed before returning home. In Shindy's case, being a complicated revision surgery, there's always a risk of bleeding and infection, just like with any surgery, but also with vascular compromise or the blood supply to the skin of the nose being fragile and weak. In Shindy's case, we wanted to observe that to make sure that she healed perfectly, which she did. The other complicating factor was the fact that she had a history of smoking. And so for revision rhinoplasty cases, and in fact all rhinoplasty cases, it's extremely important to be smoking nothing for at least 2 months before and 2 months after surgery to ensure the smoothest, best healing and the smallest, most well-hidden incisions.
Menurut Bunda, haruskah Dr. Yu buka klinik di Indonesia? Kerja sama Bunda?
Harus kerja sama bareng gue.
You out of frame. Okay.
Tapi aku boleh cerita nggak ini
Boleh,
jujur
boleh.
ya. Nanti aku udah pernah kasih tahu ke Vivian apa ya, aku lupa. Jadi banyak banget orang Indonesia, termasuk salah satu artis gede, Ivan Gunawan, yang emang udah kedoktrin sama gue. Gitu loh.
Yeah. So she mentioned.
Jadi boleh nggak sih jadi bisnis?
She mentioned like she's totally like, you know, like highly suggesting that because she mentioned that like so many like big names in Indonesia like reach out to her because of her nose. And then she started to post about this rhinoplasty journey from the very beginning. And then those big names in Indonesia, she mentioned like her best friend Ivan Gunawan is like probably like one of the biggest fashion designer in Indonesia.
And artist.
And then also like big names in entertainment industry in Indonesia. And then he's like totally everything about Shindy's nose surgery like he followed.
Dan semua teman-teman gue mau ngelakuin operasi di Dr. Yu.
And then most of them like they want to do the surgery with Dr. Yu because of her
Dia
result.
ngeliat hidung gue yang besar.
Yeah. And then she also wants to say this to Dr. Yu and team. Open the clinic in Indonesia and then make her as the business partner. So she's ready to be the business partner of Dr. Yu Clinic in Indonesia, right?
Right.
Yeah, and then and she also has like, you know, a beauty clinic in Indonesia. Would be like perfect if she has like, you know, another clinic that do the rhinoplasty with Dr. Yu, and she's totally up for it. And
Pokoknya gue doain Dr. Yu sukses.
Yeah.
Ada di mana-mana
Yeah.
seperti Indonesia, di
Yeah.
manapun itu sih.
yeah, she said that.
Karena gue sangat cinta sama karyanya.
Yeah, she said that she's totally in love with Dr. Yu result of her nose, and then she's wishing all the best for Dr. Yu. And then if Dr. Yu even thinking about opening like a clinic in Indonesia, she's totally supported all the way. And then please think about her as your business partner, and please do that by all means so I can see you more of time because you're so cute. This is my personal opinion. Yeah, because Dr. Yu is
And
super
Olive.
cute. Yeah. Me and Olive are big fans of Dr. Yu, by the way. Like we mentioned that to Haley. I hope Haley doesn't mind.
Thank you, terima kasih Dr. Yu
Yeah.
telah membuat aku lebih bersinar karena
Thank-
ini caraku untuk bersinar.
Okay, thank you so much, Dr. Yu, to make me shine even more because this is my way to shine so I can shine everywhere.
Shine everywhere with Dr. Yu.
I hope you enjoyed hearing about Shindy's revision rhinoplasty journey with me. If you have any further questions, feel free to comment below or reach out to me, and I look forward to seeing you soon.